Hi, I'm Dr. Bill Wyatt, and I'm a general dentist. I'm a member of the American Orthodontic Society and am board certified in this society. This is a group of dentists, pediatric dentists, and general dentists that are dedicated to teaching orthodontics to pediatric and general dentists, and personally, any other dentists that are really serious about learning orthodontics. Today I want to cover oversized tongues. There are some people their tongue is excessive, is rather large, and in this particular lady, it pushes the teeth out, and you have spaces between the teeth. And if you close these spaces up, she would be real flat facial profiled. And so we're going to keep these open, and she has another complication. She's got a bad TMJ problem for several years, and we had to put her in a splint for a while and learned that we had to advance her mandible to keep the jaw happy during this time, and so to prevent the TMJ pain that she had. And so this is what we did. This is a complicated case, and it may not interest some people, but it really should be interested to anybody doing orthodontics, because the temporomandibular joint has a lot to do with the doing orthodontics. If you think you can do orthodontics and not involve the TMJ, you're really mistaken as far as I'm concerned. So I'm going to start in with this case. It's a very interesting case if you are into orthodontics and know a good bit about it, and have TMJ problems with orthodontics is a more complicated way to do this. But you can look at this lady's facial structure and tell, she's even got a kind of a low angle here, and so we wouldn't want to lower it anymore. And we're going to move some teeth around in here. This will help open the bite just a little bit in her particular case. And you sure wouldn't want to close these spaces up, because you'd have a profile coming in something maybe even worse than that. They look at her from the front. The vertical height of the face here is a little lacking. It's not as much as we'd really like for it to be, but it's not far off. So we'll go on here to the next view, and you see the gaps that are in between the teeth. Now she has this TMJ problem, and has had it for years. We had to put in her splint and found out that her jaw had to be in a certain position out here for the TMJ to be comfortable. And so we don't want to bring the lower jaw back at all. In fact, we had to pull the upper teeth forward in here with reverse headgear to get them to a point where we could put this in a class 1 relation and have the jaw out here where it was comfortable to do that. So this is a pretty complicated case. It may look simple, but it is not. It's a pretty doggone tough case. So let's get into it here a little further. Now you can see we've got gaps in the upper arch in here, and over on the other side also we've got spaces in here. And so we elected in this particular case to open space here and put one more cuspid in her mouth. And we'll close this up completely and open this over here and put another cuspid over on this side of the mouth. On the bottom, we actually closed one side and brought the molars forward. Same thing on the other, but she had a big gap over there. So we'll show you what we had to do on the left side of the mouth in the case. Uh, she's got some molar teeth out over here, so we're going to have to open this up really wide and we're planning to fill these in with bridges in these areas rather than implants. Maybe back when we did this, we weren't doing as many implants as we are now. So we'll come in and close this together, but we're going to open a rather large space on this side over here, on the left side there. Now, let me advance this one more deal. So we've got this space where the teeth were removed. Some of the teeth were removed here, and you see there's a lot of buccal bone gone in this area also here, and this tooth is leaning over, so we're going to straighten it up. We'll show that a little bit better here in just a minute. Now up above, we're going to open a big space and put a cuspid there, and open a space and put a cuspid in this, and close this one up right here in the central, in between the two centrals. Now on the bottom, this molar is there, but it's leaning forward quite a bit, and this is leaning back. We're going to open this gap up pretty wide and try to bring these teeth. Some of them have dropped down in this area and behind, and the occlusion is really screwed up over here. We're going to try to bring all this together on the bottom. This was just an elective way to do this. Okay, here are the models. This fits together quite good, but we're going to open this. We'll go back with this some and over with this, and we're going to put a pretty big cuspid tooth in here in this gap. And on the other side of the mouth, now here we jumped ahead and showed you the case after we had positioned the teeth and have them bracketed. Now this is her cuspid right here. This is an artificial cuspid that we put in this area, put a bracket on it, put it on the arch wire. This is her lateral, her centrals, her lateral, and this is another artificial cuspid over on this side of the mouth here, up above. Now, when we look at the model straight on, you'll see where we put the cuspids up here and close this up. And down on the bottom, we'll move these back teeth on the right lower forward into that gap. And you'll have to look at it to see exactly what we were doing here. So we close this some, but just move this together. So it looks like we've got several of our lower anterior teeth over here in this area. Here is the center part of the lower. The midlines aren't going to line up in this particular situation. And we opened a wider space over here than we did over on this side. And our midline is going to be a little more this way in the case. So you can look at that, how we juggle that around to get what we thought was the best position of these teeth. And we're keeping her jaw happy all the time. We've got her jaw brought forward out in that area. And so now we look at it from this angle, say, well, this is going to be pretty hard because we're going to have to pick this tooth up, this upper left 6-year molar up. We're going to have to lower the upper left second molar, and we're going to have to raise the upper left third molar back here to level this thing all out across this area. And this tooth will be back here kind of picking up a little bit of the upper third molar and basically most of the upper second molar. And then we'll have a bridge filling in the whole area down here. You'll have to look at it later on down the line. She lost a lot of bone structure. Let me get this up again. in this area, and if you were going to put implants, you'd have to open that. Now this was back in the 80s, I think, maybe 90s, early 90s. We weren't doing as many implants by a long shot back then as we are now. Okay, we have a step down arch in here that's actually bowed, and it's expanding this area, pushing this forward and this back at the same time. And then we're coming in and leveling these teeth out as good as we can right here. I'll have to show those to you on the x-ray. Now this is her natural cuspid, this is an artificial cuspid, her natural lateral and central coming on around in that fashion. Now go back, here's the models again, looking at them, and we're opening this gap, opening here, closing this, and moving, that's on the upper arch, and you can see it in the mouth now that we've done it. We put a unusually large cuspid over here and smaller one over here, so our midline is not going to be lined up exactly right, but this worked out really good as far as controlling the position of the mandible and keeping the pain down as far as doing the temporomandibular joint work that we were doing. Now here's the model on the lower. You see how this tooth, it is actually leaning quite a bit, so we're going to go back and we're going to raise this molar up above. The upper 6-year molar is going to have to be picked up. Can't draw that arrow up, but it'll be raised in that fashion. We'll go back with that, and then the second molar will be brought down some, and then the third molar will be picked up a little, and this will be closed up to where there won't be any space in this area. This is not a simple orthodontic case. Now here we are, the spaces are pretty well close together in here. We've got this tooth back in the back, and everything is lined up over on the other side. This isn't quite straightened out in here yet. We'll hope to get that taken care of down the line here. Now, looking at it from the side, this has got a mirror in the cheek over here, and we're actually taking a picture of these teeth, but we're shooting the picture into the mirror right here, which gives you a shot kind of like you were looking straight at these teeth right here. You're looking at them here, so you can see how this is leveled out here and also up above on the same side. If you're not used to using mirrors in your photography, it may look confusing as heck, but you figure it out just a little bit. Now here's a mirror shot on the other side of the mouth. These teeth right here, what you're seeing over here on this side, see, so, but it looks like you're looking straight at these teeth. You're not, you're just shooting into a mirror that's taking a picture of these teeth right here and giving it back to you over there. And you can see we've closed this space. We have this step down arch. It covers over here, comes up into the molar area back there. And this tooth will catch a little bit of the upper wisdom tooth on that left side of the mouth. Now, here looking at the cephalometric picture and how it looks here. Now we had to advance this mandible to get relief from the TMJ pain in here. This lady's 33 years old at this time. I think she had fell and either really damaged her chin and her joint back, I think it's something like in the 1980s somewhere. So she's been in a lot of pain and discomfort over the years, but we've got her comfortable now and found a place where we can put the jaw and it's comfortable and everything's going along good. So we're going to set the teeth up at that point. Okay, here are transcranial x-rays of the joint itself where we had this splint in her mouth, you see, in these pictures through here, and you can see where the jaw joint, the space in here. This isn't just absolutely something that'll tell you all about it, but it'll help you along with your history of the case, you see, where it was to start and where it is. And here again, this is the splint. I think after we took the splint out and we kept the jaw in that position, it still had some space in there, and it's doing good and not having any problem with the TMJ. And that's saying something in a case like this. Okay, here we are again with another picture of TMJ, picture of transcranial x-rays that we have done on this lady, and another one that's later on down the line, and she's doing good, and so we're just happy that we're not having any pain with the case after this point. Alright, here's 1989, she's age 83, and she's had a splint. She wore a splint for quite some time here after the accident that she had. And the teeth are, this is the original Panorex that we took on her, and we were planning to put a bridge in here and then straighten this tooth up in here and level this out. And there we are, part of the way down in the treatment itself, and I'm going to show, I think, another Panorex. Here we're in pretty good shape as far as leveling the teeth out. And this is another Panorex we took in 1992. It's leveled out, her jaw's functioning good there, and there's the spaces. And we have these artificial teeth tied on here and here, and then this is going to be a saddle we'll wear with a retainer in this part of the mouth there. Here's her profile after we expanded and pushed these teeth into place. We've got a little more vertical height of the face, not much, but her face is fairly full. You could not treat this by closing these spaces up. It would have looked very bad. So you have to go in here and fill in the gaps in this particular case. And that's kind of a funny picture. They're smiling with her eyes kind of closed. But here she is, again, the facial structure. Now there she is with the smile and the braces on the teeth. The teeth are lined up pretty good the way we finished the case. And here's the gaps. When we take her retainer out, she'll look like this. But we have her wearing upper and lower retainers. It fills in the teeth here. We have no wires crossing over in between the teeth. We run these wires around the teeth, and we can fix these retainers where they stay in the mouth, and you don't need any clasp at all holding them in. They're just wraparound type retainer. Now there's the gap, and the teeth are pretty well straightened out right across here from what they were when we started. And looking at it from the front, we've got a little midline deviation, and here we didn't get this closed quite like I would like. Now this gap is bigger than this gap over here, but this seemed to work out and work with her jaw, and we didn't have any discomfort with the position of jaw, and I didn't want to bring it back over this way to close, to line this up and to expand that and close this. I was a little just I didn't know how the jaw would react to sliding it to one side. I thought it would give me some trouble, so I didn't do that. Now here's the gaps and of course I don't do any fillings or anything, but that'll have to be built up right there, of course, on this area right here. So have to be built up. Now here she is with her retainers in her mouth. Now I finished it with a slight space in here, and that's something I wish I could have closed up, but that can be done with a little bit of filling material. We've got a false tooth here and one here, and then we'll have a big saddle back in here as far as a large bridge in that area. If we look at the gap we've got in this area, it's going to be a big long bridge on that side of the mouth. Now here's the upper retainer in the mouth, and here are the cuspid teeth. Now they are different size, but this worked with our TMJ problem. We didn't have any problem with that, and we could have with shifting that just to get the same size cuspid teeth that we replaced there. Now on the bottom we'll have a acrylic saddle. We make a retainer, wraparound retainer. We put some acrylic in here, put it in the mouth, and have her bite in a normal head to shoulder relationship and close together and make indentations in it. So we grind that down to where there's just points here that are contacting the upper teeth so they don't drop down in this. And then they can come in and put a bridge in here, and they can restore those teeth up above, and the jaw will be in this same position, and she doesn't have any discomfort with the jaw in this position. And that's saying a lot in a case like this. It's had trouble with this joint for years because of an accident she had. So anyway, that's the end of the case. I'm going to back up just a little bit here and show you again the retainers that we use. Now they have to wear this retainer religiously until somebody comes in and starts doing the bridge work or the crowns on these teeth right here. Now usually a young lady pops one of these teeth off, she'll stay in your office until you get it on, or she'll wear this retainer religiously with these teeth here if one of them breaks out. Now down on the bottom you'll have to make sure she wears this, or these teeth will drift together. These will come down into this, and this will get all screwed up if she doesn't wear this retainer. I mean, you got to stay with it on something like this. Now she's not doing the super duper job brushing the teeth, but and this is pretty bad right in there. So I hope we would jack her up and keep her working on that to see that she stays there. She will not have any discomfort with the jaw as long as we keep the jaw advanced to this portion right here. Now, there probably won't be too many people interested in looking at this because they don't know enough about orthodontics to get temporomandibular joint stuff mixed up with the orthodontics and have to come out and do it. But that is where they separate the men from the boys as far as I'm concerned in orthodontics. You've got to know something about the joint to be able to come in and straighten them. And if you're doing orthodontics and you think you don't have to worry about TMJ, you just haven't been in it enough. And you really need to bone up on the temporomandibular joint work and how you work orthodontics into that to solve your TMJ problems and your orthodontic problems at the same time. So I'm going to close out on this. We have some other videos on this, and hopefully this will go through, and I hope that some of you take time to go in there and look at it, even though it takes a little longer than I like to on a video like this. People don't like to look at them very long, so but you really need to take some time. This is a good video. It may not be perfectly done by a long shot, but the information in here is good. So I'm going to stop right here, and